Good day everyone. For this week's lecture, I will be discussing the second part of the recommended vaccinations for healthcare workers, which is your hepatitis B vaccine. But before that, I would just like to give you an overview regarding or what is hepatitis all about. When we talk about hepatitis, it means inflammation of the liver. When the liver is inflamed or damaged, its function can be affected. Heavy alcohol use, toxins, some medications, and certain medical conditions can all cause hepatitis. However, hepatitis is often caused by a virus. The most common hepatitis viruses, we have your hepatitis A virus, hepatitis B virus, and your hepatitis C virus. We will be focusing on your hepatitis B virus. When we talk about hepatitis B, this is a liver infection caused by the hepatitis B virus. Some people with hepatitis B virus are sick for only few weeks, known as your acute infection. But for others, the disease progresses to a serious lifelong illness known as your chronic hepatitis B. So what is the difference between your acute or short-term hepatitis with your chronic or your long-term hepatitis B? Acute hepatitis B is a short-term illness that occurs within the first 6 months after someone is exposed to the hepatitis B virus. Some people with acute hepatitis B have no symptoms at all or only mild illness. For others, acute hepatitis B causes a more severe illness that requires hospitalization. While your chronic or your long-term hepatitis B, some people, especially those who get infected in adulthood, are able to clear the virus from their bodies without any treatment. For other people, acute hepatitis B leads to a lifelong infection known as your chronic hepatitis B. Over time, chronic hepatitis B can cause serious health problems, including liver damage, cirrhosis, liver cancer, and even death. Talking about your chronic or long-term hepatitis B, who is most likely to get such infection? Well, age plays a role in whether hepatitis B will become chronic. The younger a person is when infected with the hepatitis B virus, the greater the chance of developing chronic infection. About 9 in 10 infants who became infected go on to develop lifelong chronic infection. The risk goes down as a child gets older. About 1 in 3 children who get infected before age 6 will develop chronic hepatitis B. By contrast, almost all older children, those aged greater than or equal to 6, and adults infected with the hepatitis B virus recover completely and do not develop chronic infection. How does hepatitis B virus transmitted from one person to the other, or how does it spread? Hepatitis B is spread when blood, semen, or other body fluid infected with the hepatitis B virus enters the body of someone who is not infected or has not been vaccinated. People can become infected with the virus from birth, spread from a mother who has hepatitis B to her baby during birth, sex with a partner who has hepatitis B, sharing needles, syringes, or drug preparation equipment, sharing items such as toothbrushes, razors, or medical equipment like your glucose monitor with a person who has hepatitis B, direct contact with the blood or open sores of a person who has hepatitis B, and exposure to the blood from a person who has hepatitis B through needle sticks or other sharp instruments. What are you going to do if you think that you have been exposed to the hepatitis B virus? Now, if you are concerned that you might have been exposed to the hepatitis B virus, you need to go directly or report it to the Employee Health Clinic or Infection Prevention and Control Department immediately. Infection with the hepatitis B virus can be prevented if you get the hepatitis B vaccine and or a shot called your HBIG or your hepatitis B immune globulin as soon as possible after exposure to the virus, ideally within 24 hours. Let's go now on how are we going to prevent hepatitis B virus. Now, the best The best way to prevent hepatitis B is by getting vaccinated. Remember, your hepatitis B vaccines is safe and effective. You need to get all shots in the series to be fully protected or immune. Who should get vaccinated against hepatitis B? The following are the individuals that should get vaccinated with hepatitis B vaccine. First is we have all infants from birth to 15 months, all children and adolescents younger than 19 years of age who have not been vaccinated, adult age 19 through 59 years old, and adults age 60 years and older with risk factors for hepatitis B. Is it safe to give the vaccine during pregnancy? Yes. The hepatitis B vaccine does not contain live viruses, so neither pregnancy nor breastfeeding should be considered a reason not to get vaccinated. Is hepatitis B vaccine safe? Yes, it is safe. The hepatitis B vaccine is safe, and soreness at the injection site is the most common side effect. As with any medicine, there are very small risks that a serious problem could occur after getting the vaccine. The safety of vaccines is always being monitored. Can you get hepatitis B from being vaccinated? Of course, no. The hepatitis B vaccine does not contain any live virus and can cause hepatitis B. Is it harmful to have an extra dose of hepatitis B vaccine or to repeat the entire hepatitis B vaccine series? When we talk about hepatitis B vaccine series, this is the 3 shots or 3 doses of your hepatitis B vaccine, which is given day 1 as the first dose, after 1 month, then after 6 months. If you completed the 3 doses, that is what we call as your 1 series of your hepatitis B vaccine. Now, is it harmful? Of course not. Getting extra doses of hepatitis B vaccine is not harmful. What are you going to do if you were not able to complete a series of your hepatitis B vaccine? If the hepatitis B vaccine series is interrupted, mean to say you miss the second or the third dose, the next dose should be given as soon as possible. The first dose or the first doses does not need to be repeated. What do we mean by a booster dose, and do we need to have a booster dose? A booster dose is an extra dose of vaccine that can increase or extend the effectiveness of the vaccine. Most healthy people do not need a booster dose, but a blood test can be performed to check your immunity and decide if a booster dose of vaccine is necessary. Additional information regarding hepatitis B vaccine or common questions is, can I get the hepatitis B vaccine at the same time as other vaccines? Yes, you can. Getting two different vaccines at the same time is not harmful. Furthermore, who should not receive the hepatitis B vaccine? Anyone who has had a serious allergic reaction to a prior dose of hepatitis B vaccine, any part of the vaccine or yeast should not get the hepatitis B vaccine. So that ends our lecture for the second recommended vaccination for healthcare workers, which is your hepatitis B vaccine. I hope that everyone is aware of their hepatitis B status, if they are immune already to the virus. And I hope that everyone gets the hepatitis B vaccine, or everyone should be vaccinated, especially those who are working, who has direct patient contact, or those patients or those healthcare workers that their work involves exposure to blood and body fluids. Okay, so let us make safety as one of our priority. If you want to stay safe, if you want to be protected, get vaccinated. Thank you and God bless.